As a doctor, I've come to understand how important it is to raise awareness of health topics and to make health information more accessible to people. In this new series of Dr. Adanna Meets, I'll be sitting down with health experts and professionals discussing global health issues. Today I have here Dr. Chynoweth. Dr. Chynoweth has a PhD in global health, and she's been working on reproductive and sexual health around the world for the past 12 years. Welcome, Dr. Sheila.
Thank you so much. I'm happy to be here.
I'm happy to have you here. For today, our topic will be family planning and safe sex. So we're going to dive right into it.
Let's do it.
First question.
Yes.
What would you advise is the best way for young people to prevent contracting sexually transmitted diseases?
This is a really great question and really important. So for example, in the United States, 1 out of 4 teenage girls currently has an STD. That's a lot of people, and there are things that we can do to prevent that. There are 3 primary ways. The first is to always use protection. So when you do have sex, whether it's vaginal sex, anal sex, use a condom. If you're in a lesbian relationship, you can use something called a dental dam, which is a small piece of plastic. You should also use condoms during oral sex. I know that's not very popular, but it is important. You can transmit STDs through oral sex, for example, gonorrhea, even yeast infections. So use protection. The second thing is to get regularly tested. At least once a year. It really depends on how many sexual partners you have, but get tested. The third thing you should do is talk to your partner. Again, that might be uncomfortable for some people, but talk to him or her. Ask them, when was the last time you got tested? And if they haven't been tested, encourage them to do so.
So the next question will be, what are some different ways to prevent pregnancy?
This is also a good question and really relevant for a lot of young people who might not want to have a baby, or they want to plan to have a baby later on in their life. One thing that they can use are contraceptive pills. This is what a lot of young women use. I think the pill is great, but there are a lot of other options that might be easier for you as well. One challenge with the pill is that you have to take it every single day at the same time. You get usually monthly batches. Maybe you didn't get the next batch soon enough, or maybe you might not have enough money to get the next one. So it's important to remember there are other options. There's something called Depo-Provera. It's a hormonal injectable. You get a shot for 3 months. You're good for 3 months. One of my absolute favorites is the IUD, the intrauterine device, and I really encourage people to check it out. It is inserted, you go to your health professional, it's inserted into the uterus, and it will prevent pregnancy for up to 6 years. And when you want to become pregnant, they can pull it out, and your fertility immediately comes back. So I think that's a really good thing to look at. And the last thing to say is that you want to always have dual protection. So you want to prevent pregnancy with like the pill or an IUD. You also want to use a condom to prevent
sexually transmitted.
Exactly.
And so with I suppose the common fear with women will be if they use this form of contraception, when they do want to get pregnant, some people are worried that they might not get their fertility back.
Yes, absolutely. And I think that was a concern previously, and with very certain types of contraception. But again, with things like the IUD, it doesn't affect your fertility in the long run.
I'm aware there's another one called an implanon, the one you implant into your arm, and that stays for about 3 years.
Yes, that's right. That's also really effective as well. So there's a variety that people can choose from. Talk to your health provider, see what works best for you and your needs. There are a lot of options for you.
So another important question, what should people do after unprotected sex?
Okay, also a very important question. And this happens. None of us are perfect. Of course, we always want to use protection. Sometimes it happens that we don't. And there is something that we can do about it. That's the most important thing to remember, is you can do something. It's called emergency contraception. You can use this for up to 5 days after unprotected sex. It's a pretty big window. You want to take it as soon as possible. The earlier you take it, the more effective it is. So most countries have a specific product for emergency contraception, but it's not everywhere, or you might not be able to access it. So what you can do is combine birth control pills. If you take a specific number of specific types of birth control pills, that can also work. It's important to do this correctly, however, and we'll provide a link below with all those details for you. 2 other things to remember about emergency contraception. It is not an abortifacient. That means it does not cause an abortion.
Yeah, okay.
Really important. This has absolutely nothing to do with an abortion. There's no fertilization going on. That's not what's happening, and it's completely safe. The other thing, 2 other things. One is that if you are pregnant, maybe you're pregnant and you don't know it, it won't affect an existing pregnancy. The last thing to note is that this should not be used as your regular birth control. This is only for emergencies. So if you are sexually active, make sure you find a permanent or a method that works best for you.
Yeah, that's very important.
Absolutely.
Another situation young girls find themselves in is their partners trying to pressure them into having unprotected sex. What would you advise?
Yeah, this is also an important question, and I think it happens with both girls and boys in straight relationships, in homosexual relationships. I think a lot of different people are affected by it. I actually had a good friend. I lived in Malaysia for a few years, and she was this fantastic young woman. She was 21 years old, and she had this boyfriend who seemed really nice. And then one day she said, you know, he's really pushing me to have sex without a condom. He's like, it feels better.
Yeah.
We've been together for a while. I don't have any diseases. And so she was feeling he was making her feel guilty about it. So we started talking about it. So some of the things that I advise my friend, and I think that people, young men and women can do, is to sit down with your partner and talk to them, not when you're in an intimate space. So go out for a coffee, sit down and say, look, I'm feeling pressured, and these are some of the benefits for both of us. This isn't just about me. You benefit too. If we have unprotected sex, we're both opening ourselves up to things like HIV, potentially pregnancy, and those are things that will affect both of us. So really try to frame it in a way that your partner can see that it can have negative effects for him or her as well. The other thing to do is that if he or she does not respect you, if they don't listen, if they're pressuring you, you need to move on.
Yeah.
There are many people out there. You deserve respect. You do not deserve to be pressured. You will find many other people. And actually, that's what happened with my Malaysian friend.
Oh, yeah.
She ended up breaking up with this guy. He was pressuring her too much. He just really didn't respect her. It was very much about him. And now she's dating this fantastic guy. So,
next question, out of personal interest as well, is when is the best time to have a child?
ooh, good question.
I've been married now for some time, and culturally as well, people or my aunts or family members kind of already expect me to be pregnant.
Right.
But for me, I thought it was impossible to struggle with carrying a pregnancy throughout med school when I had to focus on studying.
Yeah.
And I believe there's some women who are in similar situations, you know, getting pressure from family or friends, especially when you have your parents who are looking forward to having grandchildren. You kind of have that pressure.
Yeah.
And so for me personally, I thought it was not the right time. But on the other hand, you'd hear people say there's no right time, because when you keep waiting, it just will never come. You keep coming up with excuses why you shouldn't have the baby now. So out of interest, when do you think is the best time to have a child? Is the right time, I suppose?
I think this is such a personal question. It's really individual. So even though you may be getting pressured to have a baby, to not have a baby, one way or the other, it's really up to you. And I think that the way to think about this is to ask yourself some questions. So for example, do I have the support network in order to raise a child? Maybe somebody wants to have a child on their own. Many people would prefer to be in a partnership. If you do it on your own, do you have other people that can support you, like a family network? Are you financially stable? Children cost a lot of money. You need to have those type of resources. Are you ready for that emotional responsibility to mold and take care of another human being? So those are some of the questions I think you would need to ask yourself. One thing that I see in my field is that people want to have a baby for the wrong reasons.
Yeah.
They want to have, so the reason not to have a child is if you want to fix a relationship, for example,
Okay.
or if maybe your boyfriend is pulling away, or he feels like he's not that into you anymore, and you want to bring him closer.
Or tie him down.
Or tie him down. That
Yeah.
is the worst way to bring a child into this world, and it also just doesn't work. Other reasons why people may want to have a child is that they want someone to love them. So they want to have that sort of affection. Having a child is not about feeling loved. It's about giving love and being responsible. Another reason is that people want to feel grown up or mature. They want to show that I'm an adult now. Some people come from problematic homes. They want to get away. They want to start their own family. They want to show that they're an adult, and those are not reasons to have a child. You really want to have a child when you're stable emotionally, financially, you have a support network, and that it's planned. You want to plan to have a child, and that the child is wanted.
Yeah. So, in summary, it's very subjective. It
Absolutely.
Varies. Yeah.
Absolutely.
Okay, so no pressure on me then.
None.
What will be some take-home points from this interaction today? What would you, if someone was listening to you, what would be kind of like the bullet points you'd want them to take away from this conversation?
I would want them to always use protection.
Yeah.
Both condoms to prevent STDs, also birth control, something that fits, with your lifestyle and fits with you. Also talk to your partner, make sure you communicate with your partner, have your partner get tested. If you do have unprotected sex, use emergency contraception. If you're thinking about having a child, really think that through. That should not be a rash decision. It should not be about you. It should be about that child. And the last thing is that there are many different options for birth control, and that you can decide at different points. Maybe the pill is good for you now. You can switch to something later. So you have options. You can protect your health, and there are many ways to do that.
Yeah, so basically you can speak to your GP, make an appointment where you run through the best option for you, and go from there. So thank you so much, Dr. Chynoweth.
Thank you.
It was a great pleasure having you here today, and I personally think I've learned a few things from you today. So
thank you so much.
Thank you so much.
Thank you.
So we've come to the end of the discussion today. It was a great pleasure having Dr. Chynoweth on the show. She has lots and lots of experience, and I can tell you today that I personally have learned a thing or two. There will be links in the description box for more information, and I hope you've enjoyed watching, guys. See you in the next.
Stay healthy.
Stay healthy.